You're listening to Docs Outside the Box, episode 37.
Welcome to Docs Outside the Box podcast. This is your official show, looking inside the minds of cutting-edge and innovative doctors. Think you'll find these stories in any medical textbook? Sorry. You're getting real-life insight from men and women pushing the envelope beyond medicine. Ordinary doctors doing extraordinary things. Let's start now with your host, Dr. Nee Darko.
This episode is brought to you by Set for Life Insurance. Protect yourself against life setbacks with Set for Life Insurance. Set for Life Insurance gets you disability and life insurance at a reduced cost with their exclusive discounts. Now that's why I use them. Visit www.setforlifeinsurance.com and tell them Dr. Darko sent you. Hey docs, are you looking to learn how to become a physician leader? Then Physician CEO is for you. Physician CEO is an accelerated business immersion program designed for physicians and developed by MBA faculty from the Kellogg School of Management at Northwestern University. The 2018 program begins this January, so learn more at www.physician-ceo.com/DOTB. What's good, everyone? Welcome to the movement, the revolution, Docs Outside the Box. I am the Doc Outside the Box, Dr. Nee Darko. And thank you again for coming back for another great episode. And just really quickly, based off of last download, episode 36, you guys were really feeling that episode. You guys really like to save on your taxes. And I guess, I need to have more episodes on financial advice and taxes and so forth. But that really was a fun episode that I did with Diane Gardner. And it looks like you all really enjoyed it. The downloads were off the chain. So please keep it coming. If you know anybody else, any other physicians, or even another professional who needs to save a lot on their taxes, please share that episode with them. As always, I want to quickly talk about an Apple 5-star review I got. Actually, let's do 2 Apple 5-star reviews. The first one is from Megan9278, and the title is Da Bomb. And he or she says, excellent podcast, very informative. Megan9278, thank you very much for a great review. I really appreciate it. And then the next one is from PA Worker, and the title is Best Podcast. And they say, great podcast, really inspired by the stories. So Megan9278 and PA Worker, once again, thank you very much for the Apple review. Everybody who's out there, if you're listening, remember the best way to thank your favorite podcast is to go on Apple Podcast and take about a minute or so, leave a review, hopefully a 5-star review. The reason why is just the way how the algorithms work. It makes the show that much more visible to people. It makes it a lot easier for listeners to find the show, and obviously makes it a little bit easier to get guests to get on the show. So I'll leave it there. If you're looking for a quick link, just go to the website, www.docsotb, that's DOCSOTB as in boy.com. Just click on any of the episodes, and you'll see either at the bottom of the show notes or at the top of the show notes, you'll see a link for either Apple Podcasts, Google Play, or even Stitcher Radio. And also, please, any episode that you really like, any episode that you're feeling, please share it with other people. You can tweet it out. You can share the web URL. There are a lot of people out there, a lot of physicians out there who are looking for something like this, looking for a community of other physicians who think like them. So one of the best ways that you can share the love, basically, is to pass this podcast along, any one of your favorite episodes, to them, please. Also, if you guys want to reach out to me, I'm always available through Instagram, handle at NiipDarko, NiipDarko, Facebook, facebook.com/DOTB, and also Twitter at DocsOTB. So on to our next guest. So our next guest, this is a little bit of a different episode. This episode, we're going to have Dr. Guy Kazarian. He is here to talk about Physician CEO. And if you listen to the beginning of this episode, if you listen to the episode for the past the podcast for the last month or so, you'll see that there is an advertisement for Physician CEO. Yes, they are a paid sponsor. And Physician CEO is a business immersion program for physicians. It takes place in Kellogg School of Management at the Northwestern University in Chicago. And it's really for physicians who need business training, physicians who are looking for leadership training, but don't have a lot of time. This program has been going on for a long time. It's been going on for some years. But recently, Physician CEO, they reached out to me. They asked me to join them in their campaign where they're trying to educate doctors about the importance of leadership, the importance of entrepreneurship. And this concept is not just for startups and for other millennials. This is also actually important for physicians. And I always use the quote, I'm not sure exactly where I got this from, but I always use the quote, if you're not moving forward, look, you are regressing. And I'm definitely all about this quote because this program is definitely going to help physicians get a seat at the table. And whether that table is with other execs who are in charge of healthcare delivery, it doesn't matter. We all need to be at the table. We all have something constructive to bring to the table. And it cannot just be the suits making decisions on healthcare delivery. It's got to be the scrubs. So I got an opportunity to review the curriculum. I got an opportunity to have an in-depth conversation with Guy about Physician CEO, and I wanted to align Docs Outside the Box, the podcast, with this program because I think that this is a great opportunity for docs, particularly docs who don't have a lot of time, to really get the training, to get the confidence, to learn about branding, marketing, entrepreneurship in a short period of time. So it's a robust curriculum, but at the same time, it's going to provide doctors with the confidence who are looking to be outside the box. And it's a no pun intended. So that's the reason why I decided to have Physician CEO on this show, decided to have Physician CEO as a trusted sponsor on the show. So things that we're going to talk about on this show is you're going to learn the story behind the creation of Physician CEO. You're going to learn who this program is for. And I'm going to take them through a little bit of a scenario where it's, should I get an MBA or should I go to Physician CEO? So it's a pretty interesting conversation. You don't want to miss that. And obviously, as a physician, he's going to answer hashtag I'm not just a doc. So without further ado, I present Guy Kazarian with Physician CEO. Welcome back to another episode of Docs Outside the Box. I have Dr. Guy Kazarian, program chairperson of the Physician CEO program. And we're talking all the way from London. Dr. Guy Kazarian, thanks for being on Docs Outside the Box.
It's a pleasure. Thanks for having me.
So we're having this episode, we're doing this interview because obviously Docs Outside the Box and Physician CEO have entered into a partnership to discuss the business immersion program that you have over in with the Kellogg School of Management at Northwestern University. And, you know, obviously Docs Outside the Box is all about giving doctors the advantage, giving doctors a step ahead and letting them basically be outside the box. And I felt as though this was a natural partnership to have with your organization, with your program. So before we get too far into the nitty gritty of what Physician CEO is, I want you to tell us all about who Dr. Guy Kazarian is.
Well, thanks, Nee. It's a pleasure. I'm an ophthalmologist. I'm in my late 50s, and I'm one of those crazy people who wanted to be a doctor from the time they were 10 years old.
You're one of those guys. Let me see your physician, your essay, your personal statement back in the day, huh?
That's right. That was it. And I wanted to do it because I saw the effect that some doctors had on people that were close to me who had illnesses, and how intrinsically valuable what they did is. And I wanted to do something with my life that was intrinsically valuable, that didn't, sure, it was going to generate an income and support my family or whatever was going to happen on a financial level, but where if I went to work and didn't get paid anything, I still felt like it was worthwhile. And of all the things, even till today, that I see in the world, being a physician is that thing.
Oh yeah, I still think it's the last noble profession still, right?
It absolutely is, and I had a very interesting experience today. I was at the London Academy of Medicine, and it's founded in the 1750s. This beautiful old building with portraits of people going back a couple hundred years with names that come out of our textbooks. So different Hutchison, and all these other people that contributed and made medicine. And you think of the tradition and the wonderful legacy of giving and learning and teaching and treating patients that we have in medicine. It's a wonderful profession.
Oh yeah, absolutely, absolutely. Now,
Yeah.
what medical school did you go to?
I went to Brown University. I was ambivalent in college. Actually, I got a little bit sidetracked. I fell in love with sailing, and I wanted to either get involved in professional sailing or become a doctor. So I applied to architecture school and I applied to medical school, and I got in. So I went to medical school, and that's how that worked out. But I practiced. I thought I wanted to be a neurosurgeon or a neurologist. I wound up discovering ophthalmology in my fourth year of medical school and did some work in the Caribbean at a outreach doing cataract surgery, and just saw the miracle of being able to resight someone who was blind hooked me. So I then shifted gears again and went for ophthalmology and got in and practiced for about 6 or 7 years after my fellowship when I developed arthritis. And it's interesting. I was thinking about the title of your show. It's Docs Outside the Box, and I think a lot of docs choose to go outside the box. But for me, I was kind of pushed outside the box because I got arthritis and couldn't operate anymore. So I had to regroup in my mid-30s and come up with another way to go and still be a doctor, but not be able to practice.
It's very, your story is very similar to another episode that we had, I think episode 20, or I can't remember actually, episode 18, but it's with Dr. Bonnie Mason. She's an orthopedic surgeon who was gung-ho about orthopedics, was practicing as an orthopedic surgeon, and developed arthritis also, and had to unfortunately leave the practice of medicine. But interesting enough, she started a program very similar to yours. I do have to put you guys in contact because I think you guys would join forces and conquer the world, actually. But it's just a very small world. So when you decided, or when you were actually kind of forced out of medicine, you have to pivot. Tell us about which direction you went to next.
So I was always interested in writing papers and doing little clinical research trials and that sort of thing. So I decided to make that my focus, and I then started to work with people to write their papers up for them and help them make presentations. At that time, the excimer lasers were approved to do refractive surgery, and the lasers were approved to do surgery on the surface of the eye called PRK. And the docs all knew that LASIK under the surface, just under a flap, was a better procedure, but it wasn't approved for that. So we organized a study, and that led to the FDA approval of LASIK for two different lasers that we did as a doctor-sponsored.
Wait. Slow down. Yeah. You said LASIK? You're involved with LASIK surgery? Like the creation of LASIK surgery?
I didn't invent it or anything like that, but I was the one that led the two FDA trials that led to the FDA approval of LASIK, and then I led the majority of the trials after that. I did those that came along that did a series of approvals in a row, and my company ran all those trials as well. So I got involved with regulatory work, large-scale clinical trials, multi-center trials, and working with the FDA, and that led to a whole series of events because the lasers needed to have if you will, end-stage calibration process that we call nomograms to adjust for each eye and for each patient, each surgeon, each laser. And so that required software. So I started a software company that wound up being sort of an industry standard that's used all over the place now to do surgical outcomes and surgical planning to plan laser eye surgery.
It seems as though, you see a need and you try to fill it, right? Or you try to you see a need and you try to, take care of it. So how did that lead you to creating Physician CEO?
Well, I was in my early 50s. I'd been doing a bunch of FDA trials, which are rather stressful. And I was working with the companies and the doctors, and I realized that I really didn't understand how the CEOs of these major strategic pharmaceutical companies look at business. And I felt inadequate with my ability to talk to them and to really contribute.
And hold on, Doc Kazarian. I don't mean to interrupt you, but it's like, think about it. No. Like, you are ophthalmologist, right? You are one of the chief investigators or reporters of the how LASIK works. You're creating a software company, and you're still saying that you still felt inadequate talking to these, to these health executives.
Absolutely. It's
Wow.
another
Yeah.
world. They see the world differently, and I see the world differently now, having gone and done my own MBA. It's a totally different framework and perspective that they bring to the table than what we do. And I was aware of that gap, and I felt like I needed to fill it. I was particularly annoyed one day because I was trying to get the laser company to put a feature on a laser that would have been safer for patients and safer for doctors. And they were telling me that they couldn't justify it. And I was thinking, this could save someone's vision. How can you not justify that? And they said, well, you just don't know what you're talking about. It has to be able to make us money. I hung up the phone. I was very discouraged, and my wife, could see that on my face. She said, well, what's the matter? And I said, well, I just feel like I'm so frustrated. I don't know what to do. And she said, well, why don't you do something? And what do you think you need to do to fix this? I said, I need to become trained in business. So at that point, she said, go for it. And we agreed I would. I spent 2 years every other weekend flying up to Chicago to go. I picked the best business school I could find for physicians, and we can talk about that a little bit. But and I got my MBA over a 2-year period.
Okay, so you get your MBA from Kellogg School of Management, from Northwestern University. Why not just say, okay, well, this is something I'm going to promote among other doctors? Like, why create like this program? Like, how about this? Why don't you just tell us about Physician CEO?
Yeah, sure. Well, it's interesting because having gone through my MBA, and there were 6 other doctors in the class of 70 people, and all of us were sort of a tight group because we approached it so differently. I think we don't realize, as doctors, that we really are not, if you will, normal. We approach learning with enthusiasm. We actually come to class prepared. we read ahead. We do all those things that you do as a doctor. That
Type A personalities.
Turns out that business students aren't quite that diligent. So we ended up kind of working together and exploring things, and we had some conversations toward the end, and then we talked to the dean, and we said, this information, these concepts, the way of looking at the world through business eyes is so valuable. If doctors had this training, we would not have had a medical crisis. This was right after the medical crisis was happening, and we wouldn't have had a medical crisis. We would have affordable health care, and patients would be better served. And we challenged them. We said, why don't you have more doctors coming through this program? And she said, well, they won't come. and so that stopped us in our tracks. We thought, well, Kellogg is known for being a marketing school, being a school that really listens to the consumer's point of view. And we said, well, this is the marketing school. Why don't you do something about that? Why don't you make it where they can come? And she said, well, why don't you? So we sat down and we worked with the faculty, and we designed a program that answered the basic question that doctors need business training. They need these perspectives. They need this empowerment, but they don't have time to come. And so we designed a program that gave them time to come and made it much more efficient for them so they could come and could get a lot out of it.
So talk about like the nuts and bolts of this program. Like how many years is it? Obviously it's in Chicago. Yeah.
Sure. So we started it in 2015 was the first run. It took us about a year to plan it. We deliberately made it about leadership. We call it physician CEO, not physician manager. So it's not about training someone to run a practice or to be middle management for a hospital or an ACO or an insurance company or a pharma company. It's about being a CEO. A lot of doctors don't realize that as they run their practices, they are functionally CEOs. They may not call themselves that. They might even have someone in their practice that they call a CEO who's actually a manager. But when it comes to what a CEO does, which is about leadership, about defining your purpose, why does the practice exist? What do we do? What don't we do? What is our brand? How do people think of us? Who do we align with? All those strategic decisions those are CEO decisions, and those are typically made by the doctors, but they make them almost from the seat of their pants without really having the discipline to know how to make them in a way that doesn't end up working against themselves. So we created this program that took all the stuff out of the MBA program that was really not that relevant. I mean, I love my MBA, don't regret a minute of it, but there was a lot of wasted time.
And I can attest to that because I have an MBA also. I got mine while I was getting my medical degree. And I'm not going to lie. There's a lot of things I don't remember, but I agree with you. There's a lot of things that let's be honest, right? Let's be real. But there's a lot of things that I still use to this day, right? So, but I agree with you on that one. Mm-hmm.
Yeah, I spent a week on a group project doing manufacturing capacity planning for computer chips in South Korea. I mean, you could say that maybe that could be translated to an operating room capacity situation, but it was a pretty good stretch. So there's a lot of things that you do in an MBA which are interesting but not particularly useful. And doctors really don't have time to explore those things on someone else's time. If they want to do them on their own, that's fine. But they need to be able to be efficient when they're learning and come home with stuff they can use immediately. So we made this, we took out the part of an MBA curriculum that was either too obvious for doctors, like Statistics 1 and that sort of thing, or irrelevant. Then we brought in all the aspects of the CEO programs from Kellogg, which all the business schools are very, very stingy about their CEO programs. They want only CEOs in the room. So we negotiated that doctors are CEOs, and this is appropriate content, and we got that content. And then we did something that was rather helpful and that the business school didn't think we could do, the administrators didn't think we'd be able to accomplish. And that is that we got all the rock star professors to teach the program. When you have any business school, but particularly a top 10 school like Kellogg, the rock star professors are like any other star in a profession, whether it's a baseball player or anything else. They kind of trade back and forth between the schools. They're world renowned. Everyone knows who they are, and they're that way for a reason. They're really, really good teachers. And I had gotten to know pretty much all of them when I was doing my MBA personally because I wanted to. And so when I called them, I said, running this program, would you mind teaching in it and helping us to get it off the ground? Every one of them said yes. So we have this roster of people teaching it that's really fantastic. I think of it as, you've been through this, Nick. We think we've been exposed to really good teaching because we're doctors and we've been to medical school, right?
Right.
But you go to business school and you realize how good teaching can be. I think of it as edutainment. You sit there and it's like watching a TED Talk after TED Talk, and you leave with these profoundly deep, wonderful perspectives that just become part of you. The methods are incredible. So we then took all that material and we said, well, what do we have on the table here that we need to teach? And it was about almost 40 days of material if you went day to day, which is obviously a lot. But then we said, well, doctors can learn at 2 to 3 times the pace of business students. So let's double the speed. And we did. And then we said, doctors can't stay away for that long a period of time. So let's break it up and give them a chance to go home and use it in between. And so we did. So they come in for 4 sessions, Saturday to Wednesday. And they can be home on Friday night with their family. They can be home Saturday morning, fly in, and get to Chicago from anywhere in the country. And they're there for Saturday evening. We begin. And then we fire hose them. There's not a wasted minute. We have activities, we have group things, we have in the building, out of the building, CEOs coming in from all over the place talking to the group. And then and they're home on Wednesday night to be with their family and to go back into the office on Thursday and Friday.
So,
and then,
go ahead, please. Go ahead.
No, and then the other component of it that was rather innovative and new to Kellogg was that everyone gets an individualized process to develop their own go-forward business plan. So they come in with we give them a template to fill out. They come in with a snapshot of their current enterprise, whether that's a practice or their startup or their foundation or their department or whatever it is that they come from. And then they morph that to their go-forward business plan during the 4 modules. So between January and September. And they actually can pitch it if they want to. It's not required, but they can pitch it to the group on the 4th module and get feedback from, like we've had the chairman of McKinsey Consulting, we've had CEOs from different major corporations. We've had innovative people from 1871, which is an incubator in Chicago that does incubating companies, and they can pitch it to this panel and get amazingly high level quality feedback on it, and everyone leaves knowing where they're going. So that was rather innovative and has really been a successful project.
Sounds really exciting. Now, yeah. Who is your perfect physician customer? Who do you want? Like, what's your avatar for this program?
Sure, it would be it's kind of a doc outside the box, frankly. It's the doctor who knows that they have leadership in them, that they aren't going to go to work and just punch a card and do a shift and go home and treat patients but they actually want to get involved in scaling and system change. Maybe they have a foundation they're running. Maybe they have a practice they're starting. Maybe they're a junior partner in a practice. They're going to be moving into the senior partner position, and they recognize they need more business skills. But it's typically and it's such an interesting question because we didn't know when we started the program who would come. We didn't know if it was going to be the people who were dissatisfied, if it was the dropouts, if it was the burnouts, if it was going to be the super achievers. Well, it turns out it's the super achievers. And so the room is full of these amazing people from multiple specialties, and they all have some history. The youngest, we've had a 30-year-old come through who was already board certified and came through, and we've had someone who is 72 years old come through. Really? We've had people come through, looking to build a practice. We've had people looking to succession planning. We've had people running departments, academic departments, but it's all people who recognize the importance, as you talk about so often, of physician leadership.
Okay. Well, it's time for some curveballs. I want to throw some curveballs at you. So what if you have, because, there's a lot of physicians out there who want to learn this business knowledge, but look, we're in Web 2.0, YouTube, Google. I mean, you could do anything online. You can learn anything through YouTube. What if someone says, look, I'm going to learn through the School of Hard Knocks, or I'm going to learn through the internet, how to do all this stuff. I don't need a program. Like, what's your answer to someone like that?
Well, I think that for some people, or just doing an MBA program, it's fine. They're not going to become exposed to the leadership content you get when you go to a program like this. This is a unique program. We designed it to be exactly for the people who come. And so there is no equivalent out there. There are maybe some substitutes out there. But there's a lot to be said for being with other people, and I think probably a third to a half of what you get by coming to the program is from the other participants in the program. So this we talk about context. Being in context when you're learning it makes a tremendous difference. It's the difference between watching a TED Talk on YouTube and being in the room for a TED Talk. It's a very different experience because you have all the opportunity to interact. So I think that the architecture of the program, the way that we've made it as efficient as we can, the way that we have it built carefully to each topic builds on the next topic on the next topic. So it's very carefully architected. The kind of people in the room, the faculty, all of those things go together to make showing up the only way that we could really do it. We've talked about doing an online version of it, but I did a couple of online courses, business courses. They were so dry compared to what happens in this program that we thought it's just not going to work. Let's keep the high quality, top quality program as we can, and again emphasize leadership and really high quality experience.
So here's another curveball I want to ask. I was going through the FAQ, I was going through the website and learning more about the program, which is it's phenomenal. But one thing I had a question about is you're looking for physicians who are basically in the specialty based fields like cosmetic surgery or cosmetic dermatology, plastic surgery, ophthalmology, obviously. But what about someone like who's in primary care? Do you not think, or not? Let me not put words in your mouth, but what about people who are in the primary care specialties?
Yeah, that's a lesson that I've learned. That was an assumption we made because it's kind of my world, and sometimes you see the world from where you sit. Turns out that some of our most successful students have been from fields like anesthesia, oncology, pain management. We had a doc last year who was from physiatry, working with pain after orthopedic surgery and that sort of thing. And we now have some internists, family medicine people, and pediatricians coming in. So that was an assumption. We have to go back and perhaps update that webpage, because it turns out that wasn't a valid assumption. The opportunity for physician leadership is everywhere, and the opportunity for doing better by understanding business is everywhere in every doctor's practice. So, I mean, pediatricians are particularly exciting because I think they're one of the most unappreciated specialty we have out there, underpaid and just kind of overworked. So what I think is going to happen is we're seeing more direct pay pediatrics, different payment models, different practice styles, and I think it's going to be the people coming through these programs that are going to be able to affect that change.
Love the answer. Now, what do you say about the current state of technology now? Because we are literally entering into a different age, a different era, Web 2.0, maybe even Web 3.0 now, with like virtual reality. And, like we have social media, you have so many different ways in which physicians can really have a relationship with patients. And, some people are doing surgery on Instagram. Does Physician CEO do any preparation or any discussion on that? Do you feel like we're at a disadvantage with all of this technology coming out and people, able to diagnose themselves with Google and YouTube? What are your thoughts on all of this technology stuff?
Well, I think it's going to change everything, like as you're describing. I have some other things that you and I have talked about. I'm involved with global blindness and working in different parts of the world to train residents where there's doctor shortages in Africa and Nepal and India and that sort of thing, with some of my other projects. And what I'm so impressed with is that in where we think we're so advanced, most of our systems are actually, whether it's in medicine or elsewhere, they were actually designed for yesterday's problems and with yesterday's technologies. And yet it's in places like Ethiopia, where we're working, and Ghana and whatnot, we're doing things very, very differently, and in many ways better in the teaching and the delivery of healthcare that I don't think we'll catch up to in the United States for another 10 years in ophthalmology. We had a student come through from Argentina who was a young guy. He was one of the youngest people in the program. He was like 34, 35 years old. He was a multi-generation ophthalmologist, Roger Saldivar, from Mendoza, and he during the program designed a system to allow them to reach throughout Argentina. Argentina's very rural in a lot of areas. It's a lot of space in between towns, and so it was hard for them to get eye care out to some of these remote villages. So they worked with Cisco during his program, and since he's really scaled it up, and they set up all these remote sites using telemedicine. He sees patients, is not having someone else see the patients. He's seeing the patients himself with all the imaging that we have in ophthalmology as if he was in front of them. And then he can talk to them preoperatively and postoperatively using telemedicine. Now, if that's not innovative, I don't know what is. It's amazing how quickly he not only saw the opportunity, but then implemented it, coming through the program, and it's scaled enormously. So I think that, when you look at doctors and you look at innovation in medicine, almost everything that exists in medicine came because some doctor said, I need something to do this for me. And then they thought, well, this is the thing that could do that for me. And then they either made it themselves or they got someone to make it for them. And then they improved it. And that's what happens when you have the skills to articulate and to execute on what you think the need is and how you think the solution can come about, and then you can go ahead and work with people to get it done. So I think your question's very interesting because everything we do today is going to change. The role of doctors is going to change. What we do as doctors is going to change. People say, oh, we have too many doctors of X, Y, or Z type. I'll challenge back and say, therefore, you're saying that everybody who needs medical care is getting it. You're saying that we've made it affordable for everyone to access medical care. You're
That's
saying
not
that we
true.
don't have any. Yeah, of course not. Of course not. And so I think that when you think about, when you turn the question upside down of medicine, and instead of saying, what's in it for us and how can we make it work for us, and you challenge yourself and say, what would it really take? It's my favorite question, by the way, is what would it take? What would it take to really bring healthcare to the entire world? That becomes a very interesting question and an immediate opportunity for physician leadership. So that's what we're doing in some of my other aspects of my life in Africa and Nepal and whatnot. And that's what a lot of the people who come through our program ask routinely is, this needs to happen. What would it take?
Right. Well, we're getting towards the end of the interview. Actually, we are towards it at the end of the interview. And just want to ask you some quick, fast questions. You just think,
Sure.
I'm going to ask you a question. You just tell me what comes off the top of your head, and we just go with that, okay? All right.
Absolutely.
So what's one thing you want people to get from this podcast?
That not coming is going to cost them a lot more and take them a lot more time than coming. It's a very efficient program, and it accelerates things. The people who say they don't have time to come are typically the people who need it the most. The other aspect of it is that the people often feel guilty. Doctors, we're always serving other people, and they feel that I don't want to do that because it's for me. I should be doing something for other people.
That's a really good point. That is an excellent point. Oh my goodness. Yeah, you're right about that.
And yet by doing this for you, you are doing it for other people. You're doing it for the people who work with you. You're doing it for your family because you're going to become more efficient and better at what you do. It really is for other people.
That's a great answer. So what's one life hack that you use for productivity? Because you are CEO of several businesses. You're flying from this country to that country to this time zone. Like, how do you keep all of it together? We want to know.
We talk a lot about this in the program. People come out of the program with a lot more time than they had coming into it because they get organized their lives better. There's two answers to that. The first answer is I really think about what's important, and I make sure that I allocate my time to those things. And you learn how to say no. So every day, and we teach this in the programs, to take an inventory in the morning about what value do I want to add today, and think at the end of the day, what value did I add today? What did I fail to add? Who did I lead? Who did I follow? What do I wish I could have done better? What came about that was unexpected, that was an opportunity? But to take that few minutes every day and take that inventory, it helps you to prioritize and causes you to realize, that you don't leave things undone because you're sure you cover the ones that are important. And the other thing that we teach is to really understand the power and the value of your network. So network science is one of the things that Kellogg is leading the world in, and Brian Udsey and some of our professors are incredible on this. To understand your network and to leverage your network in leadership is one of the most wonderful ways to leverage your own power and being able to have more effect. So if you can focus on those people who influence other people, like talking to you is incredibly effective and efficient, as opposed to just talking to one person who might be interesting, but it's going to be the end of that conversation. You want to spend your time with the people who are going to be able to help you to carry out your mission, whatever that is. So those two answers. One is prioritizing and understanding how to prioritize, and the other one is to really leverage your network and understand your network.
Great answer. So you're in London right now. Be honest with us. Is the food really that bad?
I had a spectacular dinner last night.
Nobody in London is listening, probably. I'm teasing.
I had a pretty mediocre lunch. I'll tell you that. It was like, oh my gosh, people eat this, but it was so the Michelin 2 and 3 star restaurants are popping up all over London these days. There's some incredible food here. Of course, they have something that we don't get as much in the United States as they have European wines. We get exported European wines. I think sometimes if they don't, they keep all the good stuff at home because it always tastes different when you're over here. So They have wonderful wines. It's a wonderful place.
All right. Well, I was trying to get some controversy, but it's all good. So knowing what you know now, though, like what kind of advice would you have given to yourself to Dr. Guy Kazarian as a med student Guy Kazarian?
I would have said, I did a lot of things right in the sense that I really loved being a student. I learned everything I could. But I would have said to be a little kinder to myself. take a little time, be a little more gentle. Don't be so harsh. You don't have to win at everything to enjoy more of a life and not be so completely work focused like I was. And the other thing would be, I really wish I had had some business education at a younger age. We're working very hard now to design some programs that can be plopped into medical schools and as a fourth year elective and give them a 3-month immersion into business, not CEO stuff, just business, the accounting, finance, operations, strategy, all the basic marketing things that go into a regular MBA type program, because it would have just made my life so much easier. Here's a little confession. I'll make a public confession to you. I ran my ongoing business for about 25 years, and I used to dread going into the accounting office every year for taxes because I didn't know what he was talking about. I didn't know the difference between a balance sheet and an income statement, but I just smile and just sign my name and pay the taxes and trusted people to do that. You do this as doctors. We don't like to admit when we're wrong. We don't like to admit when we don't know something, particularly to non-doctors, because that's why people come to this. They come to us because we're supposed to know stuff. So we're trained all the way. Rounds is all about training you how to look like you know what you're talking about when you don't know the answer. That's what Rounds is all about. I think that a lot of being a doctor is just about being able to project that authority and that confidence. So when you take us and you say, here's something in business and they throw jargon at you and you don't really know what they're talking about, we tend to go quiet. And that makes us victims and makes us vulnerable. So having that business education would have given me a very, very different balance and opportunity and empowerment than I went through most of my career with. That would have been more effective. And so I would just encourage particularly younger people, whether it's through Physician CEO, which love to have you come, or just in your local business school, learn business as much as you can so that you can contribute and fulfill your role as a physician leader. Because the only thing that stands between the opportunists who have invaded our profession, running our hospitals and rising the costs, and our patients is us. We have to stand between them. And to do that, we have to be able to speak the language.
Love it. Love it. So I want you to finish this sentence. I'm Dr. Guy Kazarian. I'm not just a doc. I'm a humanitarian, an innovator, and I'm focused on system change. Love it. Love it. Well, look, Dr. Guy Kazarian, this was a great interview. Really excited to be working together with you as well as with the program. I think a lot of our listeners are going to learn a lot, not only from this podcast, but obviously if they decide to enter into the program, they're going to be that much better for it. So we got to do it again. Maybe sometime we got to do it when the actual class is going on so you can give us a little bit of updates on what's going on. But this really was a great opportunity, and thank you very much for being on the show.
Well, thank you. It's a pleasure, and we're going to get you to come to the Physician CEO program. We've had a lot of MBAs come through, and I know you'd love it, and we could do one right from there.
I'm going to have to do a show from there, man.
Let's do it. Let's do it. Okay, well, thank you. I appreciate the opportunity and really appreciate your advocacy for physician leadership. You're doing great work.
Thank you very much, Guy. And that's it. Another great episode is under wraps. Listen, if you want to learn more about Physician CEO, if you want to get your learn on, if you want to get your biz on, if you want to get your entrepreneurship on, this program is for you. So go ahead and go to the website, www.docsotb, that's DOCSOTB.com. Go ahead and click on episode 37, and the links for Physician CEO are there. Do not wait. The next program is starting in January. That is quickly approaching, so do not procrastinate. Take action, imperfect action, guys. Take action. And as always, if you found this episode to be really great, if you want to share it out to other people, go ahead and do that. Either tweet it out or share it on Instagram or whatever medium that you want to share it on. Let other people know about this. And as always, I love feedback. Make sure you reach out to me on Instagram at NIIPDARKO, either on the Facebook page /DOTB, email NII@docsotb.com. There's always so many different ways that you can get in touch with me. And I've been really impressed with the feedback that I've been getting lately, whether it's through IG, Twitter, or Facebook. So keep it up. I read all of the emails. I read all of the comments. So keep it coming. And look, I'm going to catch you on the next episode. But before I jet, remember one thing. We only got one life. Let's make it count and live outside the box. Peace.